on Aging to order. We'll start with the Pledge of Allegiance, so if everyone would please rise, and Commissioner Schulberg, please lead us in the pledge.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So what I'd like to do, and we appreciate, first of all, I'd like to thank all the folks from Marin for hosting us, having us here. We're delighted to be here this morning. I'll be making a few more remarks about the commission later in the agenda, but I did want to express our delight in being here. We appreciate Lee and his team for pulling together the different aspects of the meeting. What I'd like to do is just quickly so you folks know who we all are. So maybe just have the commissioners just quickly introduce yourself with who you are, where you're from, and your relationship to aging. Carmen, Commissioner Reyes, please start.
My name is Carmen Reyes. I am from Whittier in Los Angeles County, and I work at UCLA Division of Geriatrics. So I do work in research and studies that involve older adults.
I'm Cheryl Brown, and I am the outgoing, I guess you could say, the former assembly member, and I was the Commission on Aging. I was the chair.
Joaquin Anguera from San Diego. I worked at the local area agency on aging for some 30 years, and then I went on to teach gerontology at San Diego State University.
Good morning. I'm Bob Petty. I'm from Monterey, and I managed the HICAP Medicare Advising Program there for a long time. I'm currently in my 13th year on the Advisory Council for the local area agency on aging. My area is representative to the CSL Assembly, and I recently also took on responsibility as a district liaison through the AARP Public Policy Liaison, which means I go visit legislators and advocate for seniors and tell them what we think they ought to vote for.
Hi, I'm Kathy Randall. I'm a geriatric social worker, retired, and I have been on our local advisory council, including past chair. Currently, I'm the vice president in San Diego. And then I also was president of TAC, which is AAA Advisory Council of California, prior to coming on to the Commission on Aging. It's a pleasure to be here.
Hi, I'm Jean Schulberg. I'm a professor of social work at CSU Chico, and my focus areas have been mental health and gerontology, and I'm involved in many areas of that within our community.
I'm Carol Sewell. I'm the legislative director for the commission.
And we'll be introducing these folks in just a moment. I'm Paul Downey. I'm the chair of the commission. I'm also president and CEO of Serving the Seniors in San Diego. And I'll introduce the supervisor in a moment, so we'll go to Commissioner Walsh.
I'm Ed Walsh. I'm vice chair of the commission currently. And I guess my relationship to aging, the first thing that came into my mind, I'm doing it. Every day. I'm a retired director of the Riverside County Department of Aging, and currently sit on a local board of a senior center in the desert. I come from Rancho Mirage down near Palm Springs, and it's nice and cool up here. Glad to be here.
I'm Mia Kong, and I'm a governor appointee to the Commission on Aging. My specialty is that I'm a real estate developer, and I build infill housing in the state, affordable housing. I've probably built about 1,000 units of affordable housing, both supportive housing as well as permanent affordable housing in the state. I work on housing policy as well. I sit on the advisory committee for AARP Livable Communities. So I work with governments and local governments to kind of pass new policies and laws to kind of encourage even ADA and housing for seniors that are affordable in communities in which they live and work.
Hi,
Hi there, I'm Betsy Butler. I live in Los Angeles. I am a former assembly member from the Los Angeles area and did a lot of aging issues and was very focused on the needs of our aging adults in California. Presently, I'm the executive director of the California Women's Law Center, where we look at economic issues for women a lot, very seriously, as well as other issues affecting families.
Hello, and I'm Gail Nickerson. I live in the Sacramento County, and I've been working with rural health clinics for a long time to help people get their health care in those rural areas. And I'm also gone back to the California Mental Health Planning Council from the Commission on Aging to help them help with people who are getting older.
And welcome, I'm Jane Rosansky, and I am the former CEO of the Cameo Healthcare District, which is a political subdivision of the state of California, specializing mainly in the health and wellness of the older population. And I'm very active still in my community, which is Cameo, and especially Rotary, and as some of you may know because you're Rotarians, we're getting older. We are? My name is Rita Sines. I'm from Sacramento. I'm a volunteer executive council member for AARP in California and also a member of AARP's National Policy Council and the former director of the California Department of Social Services.
Hi there. I'm Julie Conger. I am your local yokel, I guess. I live in Sonoma. I'm a retired Superior Court judge, but I sit also on assignment as a Superior Court judge. My primary interest is in elder justice. I founded the first elder protection court in the country about 10, 15 years ago. And I'm really interested in all the in elder abuse and how it is treated by the justice system.
I'm Lucy Fisher. I am from San Francisco, and I'm at UC San Francisco. I am part of a master's program in interprofessional leadership. And like Samala, I did my PhD in nursing at UC, and my topic was on nursing assistants and how the ownership of nursing homes affect the care they give.
Good morning, I'm Stephen Castle. I'm from Los Angeles. I'm a professor of geriatric medicine at UCLA and run the geriatric programs at the VA there. And I specialize in fitness programs for older adults. And what our motto is, you're never too old to get fit.
I'm Stuart Greenbaum from Sacramento. My background is in public relations, and I continue to consult on aging issues and write about these issues.
Thank you. And in the interest of time, for purposes of the quorum, we will consider the introductions as indicating the presence of commissioners, so we do have a quorum. We are delighted to have Supervisor Dennis Rodani with us, from the 4th District here in Marin County, and would you like to welcome us and add any remarks?
Thank you. Good morning, everyone. I'm Dennis Rodani, and I'm the 4th District Supervisor here in Marin County on the Board of Supervisors. On behalf of Kate Sears and the remainder of the board, I'd like to welcome the Commission on Aging to Marin. We have a very active senior community in Marin, as most of you know, and I'm extremely honored to have the Commission come and visit us. Many years ago, one of my successes in aging was I helped establish and fund an assisted living facility in West Marin, my home area. Later that day, I visited my aging parents, which really gave me the message that I needed to have that day. And that was my father congratulated me on doing such a great job. But he went on to tell me, but you know it's not for your mother and I, because we're staying in our house. And that was a really important message about aging, and really a good lesson for me. They were fortunate enough to die in their house, so they did stay there the whole time. But I also want to thank the Marin Commission on Aging for inviting me to be here today. Our job as policymakers is not an easy one, as you all know. We must adjust to our changing demographics. We must be adjusting our budgets to reflect our aging population and our senior needs. Here in Marin, we're doing good work on behalf of our aging community. We have several villages working in our cities, and we have villages that are helping our citizens with our daily routines in several cities, as I said. In Corte Madera, we have an age-friendly, citywide initiative to promote healthy senior living. Subsequently, the Board of Supervisors of Marin with the support of the Board of Supervisors, the Aging Action Initiative that was established to promote and encourage countywide age-friendly living. AIA has begun to recognize all of our senior services and programs, and we are working to bring all those service providers together through education, policy changes, and services. I'm also happy to announce that in 2018, the Board of Supervisors will be dedicating the year to our older adults. The Board of Supervisors will be adopting not only a resolution in January kicking off that effort, but it will be a year-long effort to promote education, services, and programs for older adults and their families. This will be a collaborative approach between our Aging Commission, Aging Action Initiative, the Board of Supervisors, and many other senior groups. We're still in the early planning stages of this effort, but we're eager to make a statement to our community dedicating 2018 to our older adults. Again, thank you for asking me to be here today with you. I again welcome you to Marin, and I look forward to learning more about your work today. And I'd like you to know that Marin supports its residents, it supports its senior residents and older adults, and we're happy to share our community with you. Thank you.
We very much appreciate you being here, and we're thrilled to hear about dedicating 2018 to older adults. Hopefully that will set off a domino effect, perhaps with some other counties in California, and we will take that message to other counties. And we're delighted that the supervisor is able to stay with us for at least a portion of the morning, and would invite you, as we get into discussion, to certainly participate as you wish.
Just a suggestion, I had thought, because I've been involved with the county before, I would really get together and have Ms. Stamp propose that for CSAC award. Really. I mean, I think it's deserving. We are inquiring to see if there's a possibility of microphones, so we will all attempt to project this as much as possible. Unfortunately, it's a fairly good size room, so we'll do our best. I'm going to do a couple of just routine items, and I think I'm going to switch the agenda around just a little bit so that we can get on to kind of the meat of things. But for purposes of our meeting, I do need to ask if everybody has reviewed the agenda, if there are any edits, additions, corrections, or questions. Hearing none, is there a motion to approve the agenda?
So moved.
Several motions in several seconds. Any additional discussion? Hearing none, all in favor, please say aye.
Aye.
Any opposed? We have an agenda. Hopefully everybody has reviewed the minutes from our previous meeting. Again, any edits, additions, deletions, or questions? Hearing none, is there a motion to approve the minutes? Moved several seconds. Any additional discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed? Okay, minutes are approved. Public comment. Any members of the public who wish to address the commission on any issue for up to 3 minutes. We cannot take any action on anything that you raise, but we will certainly note it for future action if appropriate. Is there any members of the public who wish to be heard? Okay. Hearing none, we will move on This is where I'm going to rearrange the agenda. We do have an executive committee report from our last two. I think I'm going to defer that so that we can get on to some of the presentations, and if there's some time, either this morning I will get to it, or we'll get to it perhaps first thing this afternoon into our regular business. So what I'd like to do is just give a quick introduction for the commissioners who have an agenda. We're going to skip down to item number 8. And that is just to give you a quick overview of what the commission is, what we do, what our responsibilities are, and how we go about executing those responsibilities. The California Commission on Aging is the principal advocacy entity in the state of California for older adults. We have a statutory responsibility to provide input to the governor and the legislature and the administrative or executive branch on issues related to older adults, whether it's legislative, whether it's administrative, whether it's regulatory, and that is something that we take very seriously. If you are here later in the agenda, you'll hear a report on from our legislative advocacy group efforts on bills, but we routinely are involved in more than 100 or more bills where we're asked to take positions, we're asked to make recommendations on how to make it better. So we are very active in that role. We are also very cognizant about presenting aging in hopefully a more positive light than perhaps it is normally portrayed in the media and in the public as generally. And that's something we take very seriously. We also have an operational plan that details in quite specifics about some of the issues that we're going to be involved in related to advocacy. I would recommend, if you have an opportunity, to please take a look at it. It's on our website, which is ccoa.ca.gov. ccoa.ca.gov. Take a look at it. We have identified several priority areas for the commission under kind of the overarching issue of poverty and those older adults most in need in the state of California. But we're looking at things like health care, community living, and elder protection are the real focus areas. Things like affordable housing development is key. Looking at Medi-Cal, looking at Denti-Cal, looking at elder justice issues are all very high on our priority. Doesn't mean we aren't looking at other things, but we've chosen to make those the focal point of what we're doing as a commission. It's a robust group, as you heard, many different areas of expertise from the commissioners, different backgrounds, all related to aging in some sense. Slightly more than half of us are appointed by the governor. 3 of us are appointed from the Assembly, and 3 of us are appointed from the State Senate. So it's a little bit of a hybrid group. We each serve a 3-year term that can be renewed 1 time, so up to 6 years on the commission. So that kind of gives you sort of a quick overview of what we do. We usually have 5 meetings a year, a couple in Sacramento, and then at least we try to have about 3 meetings that are spread out throughout the rest of the state so that we can hear from people in different areas, different communities about what they view as key issues. So that's why we're delighted to be here. And I'm going to turn it over to Lee Pullen, who's the Director of Health and Human Services, Aging and Adult Services for the County of Marin. I know you've got some remarks, and I know I'll let you introduce your distinguished panel to go ahead and make a presentation. And perhaps once we go, each of you can make your presentations, and then we can have general questions and discussion at the presentations. We are, from a time standpoint, I know we have a hard stop at 11. So with that, I'll let you take it from here.
The microphone's coming.
Very good. Thank you, Chairman Downey. This reminds me of 5 years ago tomorrow, I was the officiant at a wedding for 2 of my very good friends, and it was a large crowd, and I had said, I've got to have a microphone because my voice is very soft and people won't be able to hear me. And of course, the microphone didn't work, so I needed to project way out into the garden party. I guess that was a good thing. They've had 5 years. They'll celebrate tomorrow, and the second baby's back. So we'll see how this works, and maybe this will bring good luck to our commission meeting today. Thank you so much, Paul. Thanks to all the commissioners. It is such an honor and privilege to have you here. We've just been very excited for months about you coming to see us. I think it's been about 2 years since Sandy and I first talked about maybe the commission coming and seeing us in Marin. I think we looked back and it's close to 15 years since you've been here. So we consider this a really big special treat to have you here. And I must tell you, although I held Sandy and Carol and all the staff in the highest regards, I've really gotten to do that over the summer. I'm sure you know, but if you don't, there are just so many details and logistics that go into pulling this off and making it work and having it be a productive, effective working meeting and organization. And I just want to thank and acknowledge Sandy. Could we give her a hand for all of She's detailed, she's organized, she's mindful, perfect qualities. I hope while you're here, maybe you're staying an extra day or two and you can get out and enjoy Marin. We're about 800 square miles. I think about 80% of that. This is very good. Okay, let me know if it needs to go down any. About 80% of that is open space, national recreation areas, state and local parks, agricultural land trusts, so just beautiful outdoor spaces that we get to enjoy here in Marin. Part of the larger Bay Area. We're a small population though, about 260,000, but it's an older population. 1 in 4 people here in Marin right now are over the age of 60, and we're trending in just 13 years, 2030, which seems like it's a long ways away, but it's not. 1 in 3 people will be over the age of 60 in Marin. So wherever you go, the restaurant, the grocery store, 1 out of 3 people will be 60, 70, 80, or 90 plus. So lots of opportunity for us. Lots of opportunity to do some good stuff and have a community where older adults can live well and enjoy a good quality of life. Certainly we have our challenges, we have our concerns, we have the concerns that have been voiced to us from our older adult population through our needs assessment and our area plan and so forth. You're going to be hearing about some of those from our chairperson, Commissioner Locks, and the other commissioners here. If you were at the C4A conference last November, thank you for the forum on poverty. I was pleased to be able to speak to you about some of the issues here in Marin. Not everyone is wealthy. We have a good quarter of older adults struggling to make ends meet, falling below that economic level that they need to be able to do well here in our community. So as we approach our concerns and our challenges, we do it with the vision that Marin will be an age-friendly little community for all, where our older adults can feel safe, where they can feel secure, where they can have that good quality of life. We know what's important to them. They told us they want to be able to have access to information and to resources and to live long and live well, which is our motto here in Marin. We do that with our staff. I have my staff here today, great staff in our area agency on aging, great commission that I get to work with. I brag about my commission all throughout the state to my peers, but we know we don't do it alone. And as Supervisor Verdoni said, we've launched out in the last 4 years to create a project called the Aging Action Initiative. We realized we needed to have a strong infrastructure in place to support the population that we have now and into the years ahead. And the 10 or 12 of us, the same 10 or 12 of us that we saw at every meeting, knew we needed to have more people involved in order to be effective. So over the last 3 or 4 years, we've expanded our aging services network. I think we have hundreds of people who've attended and gotten involved with this, and scores of organizations, nonprofits, local governments, advocates, community stakeholders. We have our project director, if I could just ask her to stand up, Linda Jackson. If you want to chat with Linda, that'd be great. She does some terrific work, and what I think is really terrific for us and really was a change for how we did things in aging and adult services, we a couple of years ago moved this out. It's not my project, it's not the Commission's project, it's the community's project. We're really aiming for that collective impact. We have a steering committee that runs the project, and it's chaired by Joe O'Hare, whose place, Whistle Stop, you'll be visiting for lunch, and I know you'll have a really nice time there. It was our Board of Supervisors who spurred the idea and asked the question, are we doing enough? So that just goes to show you what a great Board of Supervisors I have, all 5 of them, and we have particular champions on the board, and I just want to give a special thanks to Supervisor Rodoni. He just joined us in January, and look how far he's advancing things. So I am indeed a lucky guy to be in the position that I'm in and work with some fantastic people who care about older adults. And one such person is our commission chair, Commissioner Locke. She has come up through the ranks. She was secretary for 2 years, vice chair for 2 years, and just became appointed as our chair of the commission this July. Now, our commission is active, it's engaged, it's involved. We don't have people who just got on the commission and aren't sure what it's about or what to do. We've got people on here who work hard and are quite active, and Chairperson Locke is definitely one of those. So please welcome her. She's going to tell you a little bit more about the commission and what it's doing.
Can you hear me? Yeah, this is good? Okay, great. Okay, thank you. I just wanted to say a little bit about our commission structure and our vision, and then introduce the speakers. The Commission on Aging, as you know, actually is advocating, it's an advocacy group as well as educating the community. And our commission has 23 members, and we're full commission as of last month. We got our last.
Yes, all 2023.
All 23. And the way that we're divided is, is that we have 11 that are appointed by the mayors and 11 cities that appoint the commissioners from their various cities and city councils. Excuse me, 1 second. I need to swallow. Okay. Anyway, and then we have 10 commissioners that are appointed by the Board of Supervisors, 2 each. So there are 5 supervisors, and so each points to the commission. Then we have our California senior legislators, L.A. Locke and Alan Bortel, who take our issues to the state and actually do draft some laws. So that makes the full 23. Now, our vision for going forward this year is that we felt that everybody should have a place at the table, and that we wanted to be known as one of the stakeholders and be invited for everything. I think it was one of your commissioners that actually had said, right there, if you don't have a chair at the table, you're probably part of the menu. I love that. It's great. It says it all, doesn't it not? Okay, so our goals going forward this year are to be continue to be active advocates, and we're going to have examples of these 4 goals. To be an active advocate for all of our seniors throughout our county, to be interactive with their Board of Supervisors or their mayors as who have appointed them, as well as we will have a presentation of how we get out in the community and present our communication as well as we do have these proceedings are actually televised on the community channel. And we're going to be supporting the age-friendly designated cities. That's one of the goals that I've put forth for us, is to the designated cities, which are 11, that by the end of this fiscal year, that all 11 will have put in their application as an age-friendly designated city. And as of this week, San Rafael, we presented our, what do we call it, our official presentation to our Mayor Phillips and City Council for San Rafael to be put on the map as an age-friendly designated city. So that would be number 5. Sausalito was number 1, Corte Madera, Fairfax, and Novato, and we will be number 5. So there's only 6 more to go. Okay. So as an example of our advocacy, Chris Asmos is going to be talking about one of the areas in which we were very active, and she is actually the chair of our Health and Nutrition Committee. We have very active committees, as Lee had said. And she's going to give a presentation of one of the ways in which we have been active and active advocate in the community just recently. So Chris?
Thank you. Thank you. I'm a retired psychologist who is fiercely, fiercely passionate about mental health and mental illness issues. So what I have to say about our advocacy was sort of driven by some of that passion, but my committee, I chair the Health and Nutrition Committee, and we have really been very active in advocating for what I'm going to tell you about, MHSA Prop 13 funds. In addition to that, we have really been very active in issues around end-of-life concerns. We've been out in the community, we've been distributing toolkits. We had Dr. Leah Duncan from Sacramento who came and spoke about the new law. So yes, we were very active. We're not to be forgotten. We're going to be very, very vocal, and we will remind people. We represent 25% of the population currently, but we're growing. And we're not going anywhere. We're going to be loud and really proud of what we believe in, okay? Okay, so MHSA Prop 63. To paraphrase what the act said was that any person, all people who suffer from mental illness deserve the same kind of treatment and funding as anyone else who has a disability. Children, adults, seniors. Yes, all of us, those of us over 60 who have worked hard all of our lives, who have championed, some of us who have championed causes for mental health and mental illness, for other just causes. We deserve to get some of that money for our services. So, a little bit of the history. What came down was the board, the Mental Health Services Act board, stakeholders, and the staff at the Behavioral Health and Substance Use Program all got together, and they were going to draft a program for 3 years, a 3-year draft. They called for 3 community forum meetings asking for input in the spring, and they were at 3 different places in the community. And I will say that our commissioners attended, each and different one of us attended the different 3 forums, giving our ideas, valid ideas, and some of them based on programs that have been existing, and gave them the kind of substance recommendations that we felt were important for our community, based on the fact that, you know, again, we represent a quarter of the population, but we were really only receiving 2% of the funding for our services. So we gave them input, that all went well, the draft came out, and we looked and we said, oh my gosh, there's no money for us. So then there was another meeting, it was back in July, and it was for a community forum asking for input. And we did attend. I think we attended in numbers. We made a 3-minute presentation, again, with a letter that preceded our presentation, with some really valid, reliable, evidence-based recommendations on how to service those people in our community who are over 60, who are depressed, who are isolated, who are underserved. And we made a pitch, a very strong pitch, with some recommendations, like 3 different tools that could be made to serve people who are depressed. For example, the pearls, these are all acknowledged, the pearls, the impact, and I forget the 3rd one, healthy ideas. We also recommended a novel idea that the county bring in a gerontologist, someone who is specializing in gerontology. We have not had that. I worked in Marin Community Mental Health for 25 years and never saw someone who had, like a psychiatrist or medical person, who had based on gerontology and geriatric expertise. So that was another recommendation. And the 3rd recommendation we made was that there be some partnering with the Buck Foundation and other agencies, again, with a novel idea so that we don't overlap services, and that there be some training in the community for all people to understand our issues. Now, given that we made that pitch, And what I'm hearing is that we need to go forward with a stronger voice because we haven't seen any changes made. So this coming Tuesday, I think some of us, many of us, will go to the Board of Supervisors and make another pitch. But again, we will not lie down quietly. Thank you.
The next speaker is past chair, Jim Morrison. Munson, excuse me. He is going to be, what is your topic is actually how you present it to the community.
Give a little background.
Give a little
I
background.
can give a little background.
Okay.
Oh, that's okay.
This is just to show you that our commission is on fire.
Well, as I've been introduced, I represent District 4, actually Supervisor Rodoni's district, so I've worked with him for years and some of the stuff he was talking about for seniors out in West Marin. And I'm happy to see some of the Commission on California Commission members. Paul and I were at the White House Conference on Aging in Phoenix a couple of years ago, and I know Kathy from going to some of the CAC meetings. And I'm very, very grateful for all the work that Commissioner Brown has done on behalf of seniors. So as a little bit of background, what we found, as with many volunteer organizations, which I take the Commission on Aging to be, that what's going on out in the community is really not as great as should be. So a task force at our commission got established in collaboration with Lee Pullen's group to do a little bit of media outreach. And so there were some professionals involved with that, and they gave little courses for us commissioners to get a little slideshow that we could take out into the community and present. And all of this came about at a time when our county grand jury had come out with very somewhat alarmist, but certainly very real concern about the so-called silver tsunami of the aged folks kind of taking over the county and gobbling up all the resources. So what I'm going to talk with you about in just a moment with a slide presentation is what I came up with after receiving this training. So I'm hoping that it'll give you a little feel for the longevity boom here in Marin County. So who is going to click the slides for me?
I think Gary was, and it concerns me that he just went out the door.
Yeah.
So Jim,
can I do that?
Dance?
Well, let's see.
But there's a problem.
Oh, okay.
Do you mind telling them a little more about the commission, the different committees we have and so forth? I don't think we covered that.
Oh, yes, Gary.
I think it called for technical assistance. The machine went to sleep. I don't know how to wake it up.
Mr. Boyle, would you like to give us some background about their commission while
in terms of the committee structure. Oh, yeah. So our committees are health and nutrition that Chris is very ably represented. We also have a housing and transportation, which I think you're going to be hearing a little bit more about this afternoon. And then our legislative task force, which does a bit of your advocacy work. And I'll talk a little bit more about that. Let's see what else we have. Media. Okay.
And public information.
And as part of this media outreach, we've gotten more aggressive about public information and education. So, yeah, no, I'm ready to. Okay, so I'm very happy to be able to talk with you a little bit about the longevity boom in Marin County and how we're dealing with it. Whoops.
Can you see, do we need to move? No.
Hmm.
Go ahead.
Do you want me to use the slides for you?
No, what you have here is a little bit out of order.
Yeah, I just have a comment, and I wanted to go back to what Chris was saying about MHSA.
Yes.
And, you know, having been involved in Riverside County up to my eyeballs with MHSA during that period where, you know, we had to fight for PEI dollars for older adults because they were cut out of it completely. But what's happened now around the state, and be vigilant here, because what's happened now is, as you know, MHSA was designed for new and innovative programming, not to sustain existing programs and services. So older adults had nothing. So they got lots of money out of MHSA because they were starting from almost zero. Children and transition age youth weren't getting a lot of dollars out of MHSA. Now, to keep those programs funded on an ongoing basis, there's a movement to siphon out some of the MHSA dollars in creative ways and transfer it into children, transition age youth, and adults. So be vigilant about that. That's happening. So those dollars we fought hard for to get into older adults are managing to trickle away a little bit.
Just a quick response and then we'll get to the presentation.
Yes, thank you. Thank you for that input. What I understand is with the PEI funds, which is part of what we're trying to impact and to share, the prevention, early intervention funds, there's still several $1 million left. And we're talking about new programs, what's existing for adults in Marin. Please understand, very small population is being serviced. Under 100 seniors. Okay, that's why I'm so passionate about getting more of the money. Thank you.
Good for you.
So are we ready now?
We're ready.
Okay, I know that Sandy doesn't like these PowerPoint presentations. Okay, so this is how Marin County is dealing with the longevity boom. And this illustrates why we have a longevity boom. This shows the life expectancy by county in the U.S. And you notice that for 2013, Marin County women were the top in the country. And the men weren't too far behind. They were number 5. Now, latest data that I know of is 2014, and so the composite of both men and women, I didn't get the separate figures, has slipped to 5. Some of these Colorado counties are ahead of us, but it's still very significant. So what this leads to, of course, then, is when you have this high life expectancy, is that your population of seniors starts to increase relative to the other cohorts. So we're right about here. This blue line here are the seniors, which, as Lee mentioned, it's about 27% of the overall population in the county now. These are our young people up to age 20, and everybody else is up there. And you notice that our trend is going to hit, 33% in 2030. So this illustrates the boom in the population that needs to be served. And the situation is a little more complicated than that, because ordinarily people think of Marin County seniors as being pretty well off, and that's really true. But in fact, our population is somewhat bimodal in that we have a significant number of seniors, probably around 20%, that are struggling to make ends meet. And this can be illustrated by this, what we call economic security index. This is for a senior renter living alone. And the estimate that in Marin County, and this is not fancy, I can assure you, is on the order of $27,000. And you see that's almost 3 times the federal poverty level. So we have significant numbers of people that we have to really make sure get the basics to increase their life expectancy to the level of the average, because these folks on average have 17 years lower life expectancy than those number one in the country that you saw. Okay, so what are these people's needs? As was mentioned earlier, the commission, along with the staff, carries out a needs assessment for our 4-year planning process, which we just finished actually last spring. And so these are the needs that people were talking about in the survey that we did. And they'll be familiar to all of you, I'm sure. Falls, cognition, financial security is a big one. In fact, these are the things I'm worried about. So this is very real out there. Oops. All right, so how are we addressing these needs? Well, the main county agency that deals with that is Aging and Adult Services, as most of you know. And this shows the mission of that organization. And basically the key words here are advocates, giving answers, and taking action. And to break these out a little bit more, the advocacy, a big chunk of that is done by the Commission on Aging, which you've already heard something about. And that advocacy takes place locally, at the state level, and at the federal level. And so locally, each of us is reporting to the folks that appointed us and arguing, well, not most arguing, but just presenting needs of seniors in a way that will be effective in getting them addressed. And then we have our legislative task force, which addresses issues at the state level, a few at the federal level, and they have an aggressive activity of evaluating all the bills, much like the California Commission does, I'm sure, at a little bit lower level. And we've worked out a very favorable relationship with our Board of Supervisors so that we're pretty free to advocate on issues that are in line with what the supervisors set as their agenda for the coming legislative session. In terms of answers, well, a lot of effort has been spent on getting a very good telephone answering service for all seniors in the county, and also a database referring people to various services that they need. In terms of action, I'll talk about that a little bit later and some of the details of what programs we're supporting under the Older Americans Act. So this tells a little bit more about our enhanced information assistance. We now have, how many? 5 social workers that are answering those phones on a regular basis, and people are following up with that. We've had this system for years, but it had kind of fallen into neglect, and that was one of the things that the grand jury pointed out. They actually tried using the service and didn't get very far. And this community resource guide is a really nice feature. You can't see these logos, but there's some really cool logos, like one there that has the gavel coming down for legal and, assistance, and there's one for health, art, etc. Now, I want to talk a little bit more about some of the programs that we have under the Older Americans Act. Our budget for that is about $1 million, and the Commission formulates a plan, works with Aging and Adult Services to find out what the needs are and what's the best way to address the needs through the plans that we have. So some of our major activities in that area are nutrition. We have an extensive congregate meal program, home delivered meal program. We also have transportation assistance with volunteer drivers. We have some home health care services available. And then of course things like elder protection, financial abuse, long-term care, ombudsman, and so on. And a key thing in all this is our partners. As Lee mentioned, the Aging Action Initiative was set up to make these large group of partnerships. I mentioned West Marin Senior Services out in West Marin. You're going to be learning more about Whistle Stop. There's Jewish Family and Children's Services here in the county. Marin Community Foundation has been a big help to us. And the whole Aging Action Initiative program is to set up a network that helps these folks to be more robust. They're doing a good job, but because of the tasks that we have to do, we just have to do it more effectively. So that's what that's all about. Oops. I'm pretty good at that. So, in conclusion, we need all the help we can get. And so, these are some of the things that folks here in our community can do, but really everyone, whether you're on the California Commission or whatnot, can be alert to the needs of your friends and neighbors, get them to the services they need. And then the last one is particularly important, to volunteer your own services. Seniors are going to be a big, big part of the solution, as you know. We have lots to offer, and it's been well shown that if you engage with your community and be a volunteer, then you'll age healthily yourself. So I tried to give you a little feeling for what's going on with the longevity boom here in Marin County. Thank you very much for your kind attention.
Thank you very much. Yes, I'll give it back to you.
I have a question.
Sure.
In your graph, you noted that the percent of the number of seniors peaking out at 2030. Then I noticed it was going down.
That's absolutely
Why
correct.
was that?
And I honestly don't know. I suspect that it has something to do with the baby boomers. That's, you know, a big cohort coming through, and I think that's the peak of the baby boomers. I think they're the peak. The baby boomers are the peak, and then that population cohort goes in.
And I also noted that the young people was getting, would be approaching closer to the seniors. It's on the graph.
Maybe you want to address?
I'd like to echo what Jim is saying. That is absolutely what is happening. It is the baby boomers. So when we look at the census information, we see 60 to 64, 55 to 59, 50 to 54, big chunks that are coming in there. So in 2030, we're going to be a pretty young older adult population because it's going to be a lot of people in their 60s and early 70s. But when we strictly say over the age of 60 plus, Federal Older Americans Act, right? That's when we're looking at it being a larger population. So I don't remember exactly what was on the graph, but the younger population should be those individuals over 60. The overall county isn't expected to grow significantly. It's just expected. Yeah, so this is going all the way out to 2050. But yes, as Commissioner Locks is pointing out, the cohort is smaller.
May I ask a question of another one of the presenters, or?
That's, so I mean, what we'll do,
Yes.
And why don't I just turn it back to you?
So what I'd like to do is we'll start with, and we'll come back to Commissioner Conger in just a moment, is we'll have Commissioner questions, and certainly Supervisor Rodoni if you have some questions. And then hopefully we'll have a few minutes if there are some audience questions. We'd be happy to take some of those. So Commissioner Conger.
Oh, and this was to Commissioner Locks. What does it take to make an age-friendly city here in Marin?
We're going to have that. We're going to have that presentation. We will have that presentation this afternoon. Yes. Each of the areas of the vision will be expressed.
This afternoon, we're housing, transportation, and age-friendliness.
Hi, Jim, I wanted to ask you, one of your slides showed a list of 6 items from your needs assessment.
Yes.
two-part. What year was the needs assessment done?
Just last spring.
So 2016 or 2017?
2017.
So this year?
No,
I'm sorry.
2016.
I'm sorry.
2016,
But
okay.
It sort of overlapped really because the plan came out this
Well, that's
spring.
okay. But my main question is, were those 6 on your slide in order of importance or priority?
Yes.
So they were?
Yes.
Okay. It's not time to start a discussion, but I found that very interesting because it was a quite different list from the needs assessment we just completed in Monterey County.
I agree with you that the questions, that you did some tweaking here, right?
No. So in our needs assessment, we had 18 possible issues, and we asked, how concerned are you? A lot, somewhat, not at all. 18 issues, which included housing and transportation, and the ones that may be popping in your mind. These 6 were the ones that rose to the top of concern, and they were the same across the economic spectrum. So the people that were doing well financially in our survey, as in addition to the people that weren't doing so well, said, yes, I'm concerned about falls at home. I'm concerned about financial security, whether it's because I'm struggling at the poverty level or I'm concerned that I may run out of my savings. So it is across the economics. A little bit different depending on your economic bracket, but these were the top from our needs assessment, which was done last year.
Yeah. Well, it just points out the difficulty from one community to another, despite how similar I would suggest Monterey and Marin would be, socioeconomically and everything. That's another discussion another time, but how to cope with, I got this needs assessment, you got that needs assessment, but they don't match, and even the top ones don't match. So how do we respond to that as commission and local advocates and everything?
Commissioner Schulter.
I have a question about the 5 social workers that were guiding me. That's very impressive. Are they full-time, or was there, what is that, and how do you fund them?
We have, they're cross-funded with Area Agency on Aging as well as part of the Department of Social Services funding. So we have 3 people that are focused on general information assistance. We have a supervisor who works in the program, and then we have also someone who does the Adult Protective Services line. So it's a crossover funding, and it's general fund. Thank you to the Board of Supervisors, Supervisor Rodoni, that supports the programs for that. So thank you.
Commissioner Rosansky.
Yes, very similar to Commissioner Fay. I was, if we could put that back up about the needs assessment. What jumped out at me was the isolation and depression.
Yes.
So last, usually you find that pretty high, unless you're in denial.
Well,
Yeah.
So the question, if I understand, you were struck that it was last, but if I could just put it in context, it's number 6 out of 18. So if you think of 18 issues, people are reporting, I'm feeling isolated and depressed, which is why Dr. Asimos and others are so active in wanting to ensure that older adults get emotional support.
Commissioner Fisher.
So in terms of demographics, we heard about age and income, and I'm wondering about, just especially concerning the phone calls, are there Spanish speakers in the county, and how are monolingual speakers?
So on our information and assistance line of the staff that we have there, we do have Spanish-speaking ability. We have some Cantonese-speaking ability within our overall aging and adult services staff. So we're the Area Agency on Aging plus adult social services, so adult protective services and in-home supportive services. We have a number of languages. We have Vietnamese available, Russian. We have a pretty relatively large Russian population in some of our programs here. Yeah, so Spanish and Vietnamese are our 2 primary languages after 2 languages after English, and we have staff to interpret and go out with others.
Commissioner Reyes.
Tied to Commissioner Fish's question. How was the survey administered? What was your response rate? And also, was it done in different languages?
Do you mind restating the question, please?
Yes, the question is about our survey, how it was done, and was it given out in different languages?
And the response rate.
And the response rate. My staff, if you can do this in 30 seconds, Amy, my staff who's very proud of what she did, tell them very quickly, 30 seconds or less, what you did. Yeah.
No, I can't. We'll give you a minute.
Starting now. Our commission was incredibly active in distributing the surveys within the community. We did over-promotion at our food banks, at senior housing facilities for low-income people. We promoted it through the Office of Education. Our local legislators all did a big email push. So we didn't, it's difficult to say response rate because we didn't mail them to people. We distributed it widely with all of our community partners in the community, and we received about 3,000 back. So while it was not a randomized survey, so it's difficult to say, is this representative of the entire community? However, because we had such a large response rate, and then actually our response rate broke down to the demographics of Marin County in general. Approximately 25% of all respondents were at or below the EESI. And actually, according to the demographics, it actually matched that as well.
What languages?
I'm sorry, we distributed it in English, Spanish, and Vietnamese. We did have a Russian contingent as well, and those were actually translated by a Russian interpreter with the Russian population. Going through question by question.
And online.
And online, we had a really big response rate online, which was fabulous.
Commissioner Castle and then Commissioner.
I'm exceeding my 30 seconds.
Just a comment, one, I think it's great to get that input so you get community engagement.
Yes,
And what I would point out, and looking at this list, is some cross-cutting issues that really address multiple domains. So caregiving jumps out at me as number one, and number two, enhancing physical activity. And so that would be a way to get at the root cause.
Thank you.
Thank you.
Good job.
Commissioner Rath.
Well done, Amy.
Were any surveys mailed out? Because I know, talk about social isolation, right? A lot of times people are in their homes, so did any of them go directly to their homes, the surveys?
Did we mail? I know we did home delivered meals, we did board and care facilities, skilled nursing facilities. Did we mail any? I don't think we just mailed.
In the Grade H newsletter, we mailed them out.
We mailed. Oh, in our Grade H newsletter, which has a distribution of what, about 1,500 people.
Yeah.
So it's our quarterly newsletter. So they would have been in there to that group. Some went to people's homes. Yes.
Yeah, and she's asking where they were mailed.
Any other commissioner questions? Commissioner Walsh and then Commissioner Bell.
I want to go back a little bit to what Jim was talking about, the advocacy in line with the Board of Supervisors, and again commend Supervisor Radoni about the 2018 year, the older adult, and wondering if that's going to make it into the county ledge platform. I can tell you, in Riverside County, we were so grateful to have the supervisors put in funding of the Older Americans Act in the county ledge platform, so the lobbyist in DC was able to, get on that all the time. So, just to
That's a great, great suggestion. We are a little bit early in the planning of this. We do know we want to do it in 18, but we're just starting the planning, so all your suggestions will be greatly appreciated. And I do want to call out to Sonoma because they did this in 2017, so we're not new with this. We're just following Sonoma's lead also. So thank you.
Yes, I've never heard longevity boom before, so who came up with that, or am I just adding that?
Who came up with that?
Our media team, when we got together a couple of years ago and said we don't want any more tsunamis, we don't need more natural disasters, but Marianne York, Commissioner York, where is she? She's the one who really, could you stand? She's the one who really said it's about longevity, so we can attribute longevity to her. We didn't copyright it. Yes, you can use it. Please use it. We want, I think you're doing something on reclaiming aging, right? We want to change that.
And my other comment is, I'm very interested to know who's in the audience. Is it Commission on Aging members? Are your commissioners for the most part, or
Commissioners and members of the public. I see lots of
Why don't you have the
people
commissioners
here.
wave their hand and then you can.
That's a good idea. So commissioners, wave your hand first.
Oh, wow.
And members of the public, active members of the public, wave your hand.
Board of Supervisors doesn't stand a chance.
No. Well, at the risk of talking about crowd size, which I'm somewhat reluctant to, actually, in my 5 years, I think this is the largest and most enthusiastic audience that we have. And so actually with that, we have about 10 more minutes, so I would actually look to the audience if you have either a question for the panelists or a comment about aging in Marin County, aging in California that you would like to do. Yes, ma'am.
You know, California is what I believe now keeps on shifting, but it's the 5th largest economy in the world. And we do export food, fresh food, to 5 continents. Why do we as seniors have to eat expired canned and packaged food in food banks and living, you're saying here that the poverty level is 10,830. I get 10,632, and I don't have money to eat. So I've been hospitalized several times, and it's been really bad because of food. Where can we get fresh food? I mean, all these people here, and I know that Jared Halfman and Tyler Florence are working in the food bank, they're the head of it, and we don't get fresh food.
Well, I can answer briefly, and I'll let Lee do that. I know that you have a robust congregate and home-delivered meal program here in Marin County, as do other counties. And the food that you will get there, I know, because my program that I operate in San Diego, we do 600,000 meals a year. By regulation, if not doing the right thing, the food, it does have to meet all nutritional guidelines and be fresh and not be expired. So I would encourage you to look to the congregate meal program or home delivered if that's what is a better option for you. I am not an expert on food banks, so I can't really address that, but Lee.
And I wouldn't want to misspeak for the food bank. I don't think we have anyone representing the food bank here. They're certainly available. We have a number of food pantries throughout the county in addition to the congregate sites where someone can go. There's also a terrific organization called extrafood.org that gathers food from, say, hospitals and supplies food pantries and helps us take to people who are under the age 60 who may be homebound. We do that also in partnership with Whistle Stop, who deliver our home-delivered meals on this side of the hill. I'm concerned about what you said, and I would like, if you would please, to connect with Gary, my assistant here, so we can talk with you further and see about what resources may be there for you or your family or friends.
Were there others? Yes, ma'am, in the back.
Hi, my name is Ruth Carter, and I'm the co-chair of the North Bay chapter of the California Alliance for Retired Americans, and also the chair of the California Democratic Party Senior Caucus. And I think there's an elephant in this room that we're not talking about, and that has to do with the dangers for our most important social safety nets for seniors like Social Security and Medicare. So I'd like to know what, if anything, is within your power to do to support these very vital programs for everybody.
Yes, that's an excellent question. The Commission is very active. We have a Federal Policy Committee chaired by Commissioner Petty. We are very active in taking advocacy positions on federal issues like Social Security, Medicare, Older Americans Act, elder justice issues. In fact, on the agenda we have some issues that we'll be discussing later this afternoon related to that. Many of us are involved in other national organizations and are very active from an advocacy perspective. The thing that I would encourage, and I suspect given your credentials you are probably already doing this, is being involved at the local level with your members of Congress and our senators to twist their arms and let them know that you're paying attention to this. An observation that this is sort of a personal observation, and I'm very involved at the national level, is that aging doesn't necessarily rise to a priority for a lot of elected officials on both sides of the aisle. And we need to be that voice in continuing to twist their arms and hold them accountable and let them know that people are paying attention to some of these issues. Because I agree with you, with the clients that we serve, they are relying almost entirely on Social Security for their income. And so any talk about changes there, changes to Medicare, changes to Medicaid, certainly have profound impact throughout the state of California, to the county, and to the city level. So I would concur.
I would just second that. It's the individual advocacy and working with your congressional offices here. Of course, it's Congressman Huffman's office. His office has been a very good supporter of the Older Americans Act program, so I'm really pleased to have him and his staff as champions for us in Washington. But it's more than just one office, as you're pointing out. We need a lot of Congress to help us with this.
Yes, sir, in the back.
Yeah. I'm Alan Mortel. I'm in the California Senior Legislature, senator from this PSA 5, Marin County. I just want to add, because it hasn't been mentioned today, that once a year we have 5,000 seniors here at the Marin Exhibit Hall, which is part of this civic center just across the creek here. And we have like 140 booths of information for seniors. They can get their flu shots there. They can meet others, music. It's all free, and it goes from 9 to 3. And this is like the 33rd year of this important information fair for seniors.
Thank you very much. And I think there was one last question. We're almost out of time, so yes, ma'am, you have the last word.
I just want to take this opportunity to do a little mental health advocacy to piggyback on what Chris was saying. We have not had much support at all from behavioral health services. We haven't had a seat at the table. We're really working hard at that, and with hopefully the Board of Supervisors, we'll be able to impact them on MHSA. But I do want to let you know that because of the Aging Action Initiative, a lot of the community organizations came together and we did an amazing training on common behavioral health issues, whether they were for people with mental health, mental illness, or cognitive issues. And I have a flyer that I wanted to make sure that you knew about, as well as a field tool that we created in the community that we're kind of hoping the state takes on. So I wanted to make sure that you knew about this before you left, and I could hand it out or leave it.
Make sure that you get it to Carol or Marcella here. And do you have an electronic version?
We can get it.
If you could send that along as well.
Sure.
We would appreciate it. Okay, real quick, we're almost out of time.
Since we have so many advocates here, on the last page, and something I'm going to be talking about tomorrow, is the Reframing Aging. And there is a great toolkit available by the Frameworks Institute on reframing aging that I highly recommend everyone look at and digest. And it's on page 33, www.frameworksinstitute.org/tooltip/aging.
Okay, thank you. And I'm Supervisor Rodoni, any last words you want to leave us with?
Just please enjoy Marin while you're here. And thank you to all Marin citizens that showed up. They really care about seniors. And like the Board of Supervisors, you really force us to move ahead and take the right actions. And I appreciate that as one board member.